Hello, Dr. Mintz here. This is an example of a patient with cerebral palsy. Now, this is a rather extreme example, but it shows that what typically happens is there is some insult to the brain in the prenatal or perinatal time period. Sometimes it can involve hemorrhage, sometimes it can involve infarction, sometimes it can involve both. But in any case, there is frank disruption and destruction of areas of the brain, particularly the cerebral hemispheres. So this is an example of a fairly severe case, and if you look here, you kind of get a sense that what has been taken out here is right middle cerebral artery distribution, so I suspect the patient, along with other problems, somehow developed an occlusion of the right middle cerebral artery, either late in utero or in the perinatal period. And on the left, there's similar findings, maybe part of the left middle cerebral artery territory. Obviously very impressive, and you can also see that the fluid in these areas of brain defect, and we call those areas encephalomalacic areas. Those areas of encephalomalacia in the brain communicate with the ventricular system. So this could reflect infarcts, but another common problem, especially in premature infants, is periventricular hemorrhage or intraventricular hemorrhage, which extends out for various reasons into the hemispheres adjacent to the lateral ventricles and can cause a great deal of encephalomalacia there. Sometimes it's a combination of findings, including hemorrhage with infarction, and those findings lead to this, in some cases, very prominent loss of substance of the brain. This patient had some difficulty draining the fluid, apparently. They put in a ventricular shunt catheter, presumably because this large fluid collection is not draining properly. And it's not really too surprising because we don't have the normal ventricular architecture and the arachnoid villi that provide drainage in the area of the sinuses, particularly the superior sagittal sinus, may well have been affected. Now, it's interesting to note here that while we have such wide swaths of middle cerebral artery territory affected bilaterally, you follow the hemispheres up superiorly, and what do you see? You see these two bands, which would seem to correspond quite well to anterior cerebral artery distributions. And here we have some posterior cerebral artery distribution. So it's not just the absence of middle cerebral artery territory to one extent or another bilaterally that suggests this was probably at least partly an arterial occlusive problem, but the fact that we can also see that there are corresponding areas of preservation, including anterior cerebral arteries and superiorly here, and posterior cerebral arteries in the occipital and posterior temporal area. At least on the left, the posterior temporal area is preserved. So, that's it for now.